In this video, we are going to talk about how to mark certain patients that have complex health needs that would benefit from some care planning and increased surveillance. So, first important thing, when I say care planning, I don't mean a patient who qualifies for an O3-O4J necessarily. So, these will often include patients who are outside of the O3-O4J criteria, but are still complex and need to be identified as such. So in this example, a clinic is going to do a couple of things to manage this. First, in the problems, we're going to create a new problem that says complex care needs. And then in the notes, we'll put in what is making this patient be complex. Let's say that this patient has MS and is also a tobacco user. So we'll hit save on that. And actually probably put that as important so that pops to the top. Okay, and then a second thing that this clinic is going to do is going to give some indication for the booking staff of a special circumstance. So let's go into the notes. So we go into the Clients tab and Notes, and let's make an expanded note. And we'll do the type as all. We want this to show up on all of the screens in the EMR. Let's put the color as purple. Now we want the message to say MS patient, same day appointment for UTI symptoms. And we're also going to note that they are not on the self-management protocol. And let's make this a pop-up. So we will hit save. So if we go out of this patient and come back in, you see that that had popped up as the pop-up screen, and also it will show up here. So this will allow the booking staff to see that once the patient is coming in and asking for an appointment, that they are to get them into the clinic the same day for the UTI symptoms, and that this patient is not already on a self-management protocol, so they actually will need an appointment to the clinic to be able to get that lab rec and the hopefully antibiotics going. So that is an example of how a clinic might use problem list and expanded notes in order to manage their complex patients.